Good evening, everyone. Welcome to the annual Fireside Chat by the Michigan Neurology Residency. We're your hosts, Craig and Bobber, and we're here tonight on a beautiful evening with a fantastic fire at our side and a nice glass of bourbon. But you know what? There's something missing tonight, Bobber.
What's that?
I'm thinking that we need to have a deep intellectual discussion about something.
Well, you know what I've been thinking about a lot?
What?
I've been thinking a lot about Gait.
Oh.
Gait is amazing. You can learn so much about a patient. You can learn about their functional status, what sort of neurologic diseases they might have, and most importantly, it's fun to talk about.
You're right. We should talk about Gait.
Well, Craig, maybe we should first start with the basics and just talk about normal gait.
Yeah, that's excellent. When you think about assessing somebody's gait, you need to think about things such as their posture, their arm swing, things such as their base and their stance of how the gait goes, and then stride length is also important. So if you think about normal gait, a person who has normal gait will have symmetric arm swing, as well as symmetric stride length that seems pretty regular, an upright posture, and a narrow base gait.
Oh, what do you mean by narrow base gait? I feel like I've heard a lot of people say that, and I don't really know what that means.
Yeah, it's a great question. You know, narrow base gait means that the heels of the patient should almost touch each other as it's going through the swing phase, step after step.
Oh, that makes sense.
I'ma make you beg, I'ma make you beg for it. I'ma make you beg, I'ma make you beg for it. Pulled up looking picture perfect, baby.
But Bobber, what about some of the types of abnormal gait we see?
Yeah, I think that's a wonderful topic to talk about. My favorite gait is hemiplegic gait. That's the type of gait that you see when someone has damage to areas of their brain that affects their upper motor neurons. For example, an MCA stroke. So if we had a patient that had a left MCA stroke, that causes a very typical pattern of gait abnormality that you can see. So if they had a left MCA stroke, on the right side, they would have weakness in extension of their arm and weakness in flexion of their leg. And so they walk with their arm flexed, and they walk with their leg extended and plantar flexed. In order to overcome that, because their leg is extended and they can't flex, they have a circular motion, what's called circumduction.
Oh.
So why? Do the stanky leg, do the stanky leg, do the stanky leg. When I hit the dance floor, do the stanky leg, do the stanky leg, do the stanky leg.
Well, let's talk about my favorite abnormal gait, ATAXIC gait. Commonly seen in patients with cerebellar disorders or cerebellar problems, like say, for example, alcohol abuse. So think about picture college friend, drunk, walking home with a wide base gait, staggering and clumsy on the side of the road.
Damn, it feels good to be a gangster.
Well, Craig, now imagine the setting where you meet someone who has a resting tremor, slow in their movements, and has a masked face. That's a great setting to talk about Parkinson's disease.
Yeah, what's wrong with somebody's gait with Parkinson's disease?
That's a really great question. In fact, patients with Parkinson's disease tend to have a pretty classic gait. You have to remember that bradykinesia is a core feature of Parkinson's disease. Bradykinesia means slow movements. So when we think about a patient with Parkinson's disease, it's very much characterized by slow movements. They tend to walk with a stooped posture and have difficulty initiating steps and tend to take very small steps. In fact, some people call it the march of the little steps. Interestingly, though, once they start walking, occasionally patients can have what's called festination, which means involuntary acceleration in their speed.
Oh, wow.
Finally, patients at the end of their movement, if they're trying to turn, they have difficulty turning too and have to take multiple steps. That's known as en bloc turning.
Fascinating.
New Cupid, January 2nd, 2007. Time for a change. New Cupid. King of Swing Out, baby. January 2nd, 2007.
sometimes patients with peripheral nervous system problems have abnormal gait. Say, for example, somebody with foot drop. They have what's known as steppage or neuropathic gait. And what happens there is that they are unable to dorsiflex their foot, so in order to keep it from dragging on the ground, they have to lift their leg high enough that when they bring their leg back down, it causes a classic slapping gait. Well, Bobber, thanks for another fascinating discussion on gait abnormalities. And thanks everyone for joining us for our fireside chat tonight.
I think before we leave the viewers, though, we should tell them about one more gait. It's a gait that I find to be quite invigorating as well as disturbing, but will definitely help land you a date.
Oh, oh, oh.